Hello and welcome back to the Healthtech Vision podcast. My name's Jessica and I am joined by the wonderful Belle. And here, as I'm sure you probably all know, we break down the health tech news every single week. And that is exactly what we're here to do today. So I think it's a lot of AI chat as usual for this week. But before we get into that, Belle, I'm keen to know, you have been to Rewired and I'm sure you're feeling inspired by all of the cool stuff that's going on. But if you were to invent a gadget or a technology, a health technology, what would it be?
An excellent question. Love starting with an icebreaker. It's always kind of the weirdest part of corporate things, isn't it?
Yeah.
I once did a corporate icebreaker and someone said that they ate their twin in utero and everyone just took about 5 minutes to digest what they said and realised it was a joke that didn't really land.
But also not really a joke because it's probably true.
Anyway, what would I invent? Should I be an inventor? I reckon, and I know there are loads of companies already doing really cool stuff in this space, so maybe it wouldn't be that much of a novel invention. But I think if I were working within health tech R&D or development, I would definitely be interested in seeing how we could use period blood as a source of analysis for women's health conditions and other things. Like, there's so many different measures of health you can get from period blood, it seems, and also really incredible longitudinal data, like every month for your whole like menstruating life. So I think I would definitely do something with that. I know some people do, like there's things around smart tampons and being able to use it in that way. But not everyone uses tampons, and smart pads might be easier, but again, not everyone's comfortable with that. So I think trying to find a way where people could easily capture those kind of biomarkers and get that incredible picture of health month to month, year on year, I think that's what I'd want to do. I'm sure there's just so much incredible data there. And it just seems like such a waste, right? Like going to get a blood test, maybe you get 1 a year or 2 a year if you're unwell and your doctor thinks that you need it. But actually having something every month, much like I know you like to wear wearables and things like that to get that longitudinal picture of your health day to day. But I think you just see such incredible fluctuations in, and get a really like idea of people's baseline health and how their hormones change as they age and have children and all that good stuff. So that's what I'd do.
I think that is a fab idea, and I think we will maybe see this being more mainstream, because must have been about a year ago now, I went to an event with 28X, which is a new cycle tracking platform that hosts your data on your device rather than in the cloud. So you own it, and so obviously there's a whole bunch of like special data protection around that, which in the current climate is amazing and important. But one of the things they do is I think they have a partnership with another company who does that, where you can send off your period blood, and I think you get paid for it. And the thing, this is a long-winded way of saying, at that event, and I haven't fact-checked this, maybe I need to, but period blood is more valuable gram for gram than gold.
Incredible.
So, it's not, obviously from a health perspective, it's great. It's a rich source of data and would give you a really accurate picture of your health and, that longitudinal picture, as you say, over time, but also savvy financial decision. Really savvy financial decision.
Is that not how they're measuring value in the first place? Like value from the data that comes from it? And
no, I don't think so, because I think basically you get paid to send your menstrual blood in.
I see what you mean. So you're saying that the payment per volume of blood that you send, interesting. Yeah, because you can get a lot of data from such a small sample.
Yeah, exactly. And also I think there's things like, I've seen Throne, which is a US company, which is like a smart toilet seat.
I've heard of that one.
I don't know if they use menstrual blood yet, but they use like your stool, your poo, and maybe your urine as well for biomarkers. So it would make sense that if they're not doing that already, that the next step would be menstrual blood there as well. Because, it's just, it seems obvious. And if you've already got the technology that's able to process it. So I do think that's going to become way more kind of mainstream, and it'll be really interesting because the likes of Whoop and Aura obviously are wearables, right? But they have recently rolled out testing services like lab diagnostics, and that's kind of a similar thing, isn't it, as well? Because you've got your kind of digital biomarkers and your platform where you've got all of your data, and actually Ultrahuman do it as well, I'm pretty sure. I think they do lab testing, and it's a much more long-winded way of doing that, where you do your blood draw, probably finger prick test, you send off your bloods or maybe whatever other bodily fluid, and then you get those results back. So I think not only is it going to become more widespread, it's clear that more companies are moving into this like hybrid digital and physical biomarker domain, bringing that both together for a much richer picture of health over time, which also is just, imagine being able to share your like lifetime worth of data with a doctor. When we think about like endometriosis, for example, and how long it takes, I think it's about 10 years still on average to be diagnosed with endometriosis. And, you can basically then share, a lifetime of digital and physical biomarker data that can then be analyzed and maybe get to a diagnosis way quicker. I just think, it's really cool that I just see it as becoming more mainstream. I almost see it as like, how when Alexa first came out, everyone was a bit like, oh, it's listening in. I feel like everyone has Alexa now, or like Google Dots or whatever they're called.
Not me.
So we have one, but it's very much unplugged because the plug sockets are in use with probably the toaster or something, to be honest. But I just feel like it's kind of moving in that direction, where the intersection of those biomarkers and testing, you almost create like a health data hub.
It seems like a complete no-brainer, doesn't it? Like, as you say, there's already the technology to do this, to collect things, to sample them. And as people are more interested in their health and they are tracking things on a daily thing, it doesn't then make sense to just have a once every 6 months blood test or urine or stool test, because it's not complementary. Whereas if you were to consider like daily stool samples alongside daily tracking, if you've got an elevated temperature and your watch or your wearable is flagging that, and then you could see that your urine or your stool or your period blood is showing something else, it provides a richer picture, which allows you to sort of make better calls earlier on. And like you say, take that to your doctor, who can you then not have to wait for you to get referred in to have a blood test, wait for the response. Like, they've got that data up front and can say, look, this might be due to this. Let's look into that a bit more. It feels like a no-brainer. And I think we'll get to a point as well where it's really quite discreet. Like, I don't know what the technological like design is of a smart toilet, but in my mind, you think of those little like cardboard things you've got to poo into, which isn't necessarily the nicest way of giving a stool sample, or trying to get it in a test tube. But I'm sure there'll be a way where it samples it goes, and
I think it basically will end up being like a toilet duck.
Yeah,
exactly. Like the things you just clip on the side. Yeah. Maybe that's a collab made in heaven, where you've got your toilet product and your biomarker. Yeah, Harvick and a Whoop collaborate. There we go.
You heard it here first.
It's true. I would love, though, on that note, for wearables to just become so discreet that you don't notice them. So like,
agreed.
I like an Apple Watch for its functionality. I hate how it looks, but this is really, really embarrassing. I forgot to take my Apple Watch off on the day I was getting married, and I've got all of these really beautiful photos of me getting ready in like my pajamas, my hair's being done, my makeup's being done, and I'm wearing my Apple Watch, and no one told me until I put my dress on. I mean, unfortunately, I managed to not walk down the aisle in it, but do you know what I mean? Like, it like
your stress levels just peaking.
Yeah. actually, it was probably like one of the most chilled days of my life.
Yeah.
But yeah, like I would love it to, like, this does not look like jewelry, this ring. I would love it to actually look like
Yeah,
jewelry.
agreed.
And like, I would, yeah, I don't know, like, and you think about smart clothing and all that sort of stuff. So I think, like, and you know, the smart toilet seat, it would just be ideal if I could just have the toilet seat of my choice. We're actually choosing some new toilet seats for our new bathroom, deciding which color wood to have. So if I could just, you know, I could have the toilet seat of my choice that fits with the aesthetic of my bathroom and the biomarker elements combined with Harpic, then ideal.
I tell you what I like the idea of, because I don't wear very much jewelry, as you know, and lots of that is embedded in the fact that I used to have eczema on my hands, and so I don't wear rings because I get paranoid that they trap water and it sets my eczema off. I wear earrings and that's it. But like I wear so I'm looking around to kind of get a visual of my headphones. I wear in-ear headphones a lot. I use them for calls. And I've heard I'm pretty sure Apple put out a patent for potentially like adding in some sensor technology into some in-ear headphones. I feel like I remember that.
I've seen a smart earring as well, you know, actually.
Yeah, see,
and it looked like an earring.
See, that would be great.
I would
like
totally
the
be
idea
up for that.
Working with your lifestyle. So someone that doesn't wear rings, doesn't, you know, I only wear a watch when I you know, I wear a nice watch when I'm dressing nice.
Yeah.
I don't wear something day to day. There's nothing from my elbows down. But I do when I'm leaving the house and I want to kind of, you know, have that nice thing that's looking at the time that's not my phone. But I would like, you know, if there were smart earrings, I'd wear them in a heartbeat if they looked like the jewelry that I like to wear, because that's how I like to wear things. Yeah, I'm sure we'll see a world where that happens. And actually, you see it a lot in futuristic films and things of people getting sort of tattoos of barcodes and things. But also,
okay, well, that's terrifying.
Well, no, I don't mean barcodes, but you can get sort of like inks and things which can be smart, like smart inks, and can do interesting things.
That'd be great for allergies.
Yeah. So I think there's lots of cool stuff, whether it's in a tattoo thing or almost like very small discrete stickers that you put on for allergy tests and things that have like interesting inks and chemical reactions within it that are just like in a very flat sticker.
Yeah.
So I think there's lots of cool stuff around the horizon.
Yes. And obviously the important thing is just enabling widespread access so that it can help the people that it really needs to. Because I think it's all well and good, you know, me joking about being able to have my toilet seat of choice and, you know, first world problems. But ultimately, this stuff is only as good as the people it can reach. And so I think, you know, we're getting better at that data layer and hopefully that like data integration. But we see all these wait lists for blood tests and all that kind of thing. And if we had something that was way more readily available, you could almost kind of, even if it was walking into your GP surgery and picking up a pack that you just you know did a blood draw and you could send that off. Yeah, I mean, I don't know. I'm massively oversimplifying it, but I just think that like, again, we need to look at incentives and we need to look at access, because ultimately, that's where it's going to make the greatest impact, and ultimately also the richest data. We can learn so much from this.
For sure.
You know, you think of like if we were able to do this kind of testing on a much more regular basis, you know, I think there'd be less resistance from clinicians to do blood testing. And it would get people diagnosed quicker, but also there'd be such a kind of rich data lake almost that would be so valuable in lots of different ways. How we build services, how we better support certain communities, but also how we like drug discovery and
exactly,
you know, optimization of treatment regimens and all of that kind of thing. And you know, I'm obviously preaching to the converted, and you know, it's a big part of what, you know, like Healthtech do, for example.
Quite,
it's making like those kinds of touch points, I guess, more frequent and more accessible without overburdening a system, and also overburdening people, because you know, it's one thing being able to just do a blood test at the click of a button whenever you fancy it, but you know, that's obviously going to lean into anxiety for some people, and who's reading the results at the end of the day and translating it then to the person who they go to and all of that stuff. I think definitely, I'm oversimplifying a big challenge, but it's got to be thought about.
Well, I think that's why, as my burgeoning inventor, wearing my hat, that's why periods blood is so interesting, because if we can get to a way where we're using tampons, pads, the things that people are using anyway to manage their periods, then there isn't an investment needed in a smart toilet, in a fancy piece of tech,
that's true.
in going to your GP or anything. And a GP could even say, like, maybe there's a woman who's come in, like you say, she's got symptoms, maybe it's endometriosis, they're looking for that. A doctor could send that person away and say, look, here's a week's worth of smart period products for when you're menstruating, and we can use that to like infer your and help your diagnosis. The GP can still provide that, but a woman can use it in the way that they would be managing their period anyway, so it's not an additional uplift. Because I mean, I know, like, I'm someone who is quite queasy with things in general. Like when you get sent home with doctors to do sort of self, when you sign up to a new doctor's and they're like, oh, can you take this swab and do some stuff? It'll be easier for you to do it at home than come in. And I'll put it off because I'm like, I don't want to. Speaking of, I remember making a pact in the last pigeon that I'd book my smear test, and I haven't.
Oh yeah, me too. And even my friend messaged me the other day saying I just had my smear, and I was like, oh, that's another good reminder.
And I still haven't done it. Yeah.
Okay, so after this recording, Belle, we're not going to leave this call until we've both booked our smear tests.
But I do kick these things down the line.
Yeah.
I know what I'm like. So actually, something that just slots into what you're doing anyway would just take that layer off and make it so much more accessible to people.
Yeah.
So
I think the key to probably access is finding like the use cases, like the initial use cases where it can have the greatest impact and rolling out from there.
Mm-hmm.
But anyway,
I tell you what, sorry to go on to a slight diversion, but not really. I've been reading a lot in the past few weeks and months, actually, of sort of a rising number of women reporting severe iron deficiencies. Like I keep hearing and reading about it, and I don't know, like, what's the cause of that? Like, is there something wider at play societally, or the modern lives?
Are we eating less red meat?
Are we? Yeah. Is it because we're eating less meat? Like, is it just that women historically have just written off the symptoms of iron deficiency with just being overworked, overtired, or whatever, and actually, all those symptoms can be iron deficiencies. Also, I've heard of multiple women, my sister included, I'm sure she won't mind me sharing this, who has gone to a doctor and they've said, oh, obviously, you're low in iron. And he's like, I hadn't been told that. And she's got, markers on her GP files saying her iron's really low, and that's never been communicated to her. So she didn't know, and was there for other reasons. So never thought to ask. She was, talking to the doctor about something different. But I mean, blood sampling through menstrual blood would be a really, really like obvious and easy way for people, for women to be getting regular, regular analysis of their blood and see kind of what their iron levels are at as well.
So much to think
about.
Let's get inventing. Innovate UK. We're going to come and find a grant. That was a tangential icebreaker.
A good icebreaker.
So let's get into I was going to say let's get into the Healthtech. We've been talking about Healthtech, so it's, let's continue in the same vein. But you went to Rewired this week, didn't you? Talking of gadgets and Healthtech solutions. How was it?
It was really good. I went yesterday, so I was there for day 2, and everyone who was there, who was exhibiting and had been there for both days, said that day 1 was absolutely insane, very, very, very busy, and yesterday was much calmer. So I think I chose the right day to go around and have some nice conversations with people. But it seems from everyone I talked to that it was a big success for them, which is really nice. But yeah, it was really good, actually. I think it's so nice to kind of see all the different health tech innovations together, see the sorts of work that people are doing, the partnerships that they've got, the things they've got coming up, which are exciting. And yeah, interesting to sort of see kind of, that kind of pulse checkpoint of where the industry is. And certainly, I mean, it was clear, I think, from everyone I talk to that, AI is the name of the game. Like every company has an AI product in some way, it seems, whether they're an AI first company and that's their core product, or whether they're a company that's now got an element of AI in one of their features or things like that. So very much everyone is riding the AI wave, it seems, in digital health. But some really, really cool things. And it was nice as well to see lots of people celebrating success with various NHS trusts that they've already partnered with, and obviously looking to partner with more. And some of those companies were homegrown UK companies, but seeing companies coming in from across Europe as well, or even from America and actually, I spoke to a company that have got 300 hospital partnerships, I think, in Australia, and have come over, and they've got in the tens in the UK, but Australia is still their biggest market, and they're coming to the UK, which is interesting because lots of the conversations we're having with UK companies is that they're looking to Australia as potentially another market for them. So, and actually the same with Europe. We know people that start in the UK and look to Europe. It's nice to see that it goes both ways. You've got those success stories now coming into the NHS and using that as an evidence base to win their pilots and to convert that into partnerships and things. So yeah, it was really nice. Lovely to see people. I will say, and I'm sure no one will mind me saying this, that health tech companies, you go around and it's like, it's pens, it's notepads, it's anti-bac. I got a lens cleaner.
I need to do better with the freebies.
The first stall I went to, because it was day 2, just basically they pointed to the stand and said, that's the best quality bag. So go get that one to get your bits. So that was a good piece of advice.
I always think that is actually a very difficult thing to figure out, which is what is like good stash. To be fair, I love a good I do like a decent notebook and a pen. There is only so many of those you can take. Water bottles, I've got too many of those. And you don't want to seem like you're not being very giving by not having something. I wonder if just cupcakes and chocolate might be the way forward.
There was a lot of chocolate, which is quite funny because it's a health tech conference, but lots
juice,
of people were
a green juice. I'd love a free green juice.
I saw some like shots. I had a bit of a dodgy belly yesterday, so I wasn't indulging in the snacks and things, which is unfortunate. But yeah, I saw lots of like ginger shots and like turmeric shots and things. That was quite fun. Yeah, some nice like sparkling waters and things.
Often like system level health tech, which is if it's more consumer health, like the giveaways are really obvious, whereas it's not quite that kind of clear cut when you're a product that's integrating into an EPR, or you're a global printing company, and yeah, otherwise like things just get thrown in the bin. So I think you do have to like work harder to figure out what the free thing is. And I think, to be honest, the stands always win, and ones with the coffee machines on them.
Oh my gosh, so many coffee machines. And again, I wasn't indulging, so it's a shame because I would have sampled and given my feedback, but loads and loads of baristas, which is really nice to see. So my favorite freebie, and this shouldn't really be the point of focus of this discussion, but I can talk you through some of the science of it, which is quite cool, is that
yes.
And for anyone on the video thing, I will bring up a picture of my eye. Appreciate most of you are listening to this via an audio medium, so it won't work. But I went to a stand called Daedalus, and they were taking photographs of people's irises, which is really cool.
That feels very intimate.
I've now got a printout of my iris, which is so fun. And when I went up to the stand, I assumed they were some sort of ocular technology assessment app, and people were taking eyes and they were showcasing scanning or screening or something, but it was literally just sort of a gimmick to bring you in, which was quite fun. But yeah, I learned loads about my eye, which is cool. So I've got these rings around my iris, and again, I'll flash up the picture for those on the video. But it looks a bit like a cross section of a tree trunk. I have sort of tree colored eyes now we're looking at it. But I've got quite strong rings around my eyes, and they look like white rings, like a tree. And she basically said that as your iris grows, it gets bigger, obviously, when you're going from a baby to a child to an adult. And much like trees, it kind of expands outwards. And the rings are sort of signifiers of that growth. And they're essentially like stretch marks. So,
whoa.
Yeah. So as your iris grows, they're sort of like, they're gaps in your iris. And because I've got darker eyes, the collagen, the pale collagen behind my iris peeks through the gaps. And that's the like rings you can see. Isn't that cool?
So basically what we've learned today is that
Bella's
you have stretch marks in your eyeballs.
Yeah.
Wow.
And then that's like a little birthmark or a freckle.
Oh, cute.
Anyway, great freebie because firstly, I had to get it done and I talked to the team for ages. Then I had to go back and collect my print and I talked to them again. But they were a really great team. And I thought that was really cool. As someone sciencey that likes like nerdy stuff, it was like a cool thing to take away. And actually we were saying before this that when I was a student, I once kind of said yes to some students that were looking for volunteers for a brain MRI because the output was £50 and a picture of your brain. I was like, yes, I want a photo of my brain. So nice to sort of have that.
I think you need to probably frame both of those and find somewhere to put them in your house.
Yeah, it's cool.
They do say that the eyes are, is it the eyes are the window to the brain? No, the eyes are the window to the soul. But your soul exists in your brain, right?
Why not?
I did not go to a conference, but I did the other day get to go to a really cool clinic where they are using like VR headsets to again measure brain health and like the impact of concussion and like head trauma and all of that kind of thing. And we were talking about Parkinson's, and apparently basically like there are all sorts of tests they do and you follow dots and crosses and all this kind of thing, and some of the tests they do measure and I'm going to probably like absolutely like obliterate the explanation of this, but apparently the movement of the up and down movement of your eyes is an indicator for, it can often be an indicator for potentially the onset of like neurological conditions like Parkinson's, and you can then track that over time to see how your condition is progressing or to measure treatment and all that kind of thing. And just, I mean, yeah, mind-blowing stuff that you can do just by following some, I mean, it was this is an oversimplification, but it was it almost felt like when you go to the opticians and you have to do all of those tests where you're looking into the dots on the horizon. It was a much more sophisticated version of that on a VR headset, and it's amazing what you can learn and measure through your eyes and the movements of your eyes and the movements of your head and how you're using your neck and all that kind of thing. It just like, that coupled with the photo you've just had and all of that sort of thing. We talk about biomarkers and stuff. There's so much that you can do and see with the eyes as well.
It's amazing. And actually, I mean, I've know that company and the work they do. And what's kind of fascinating about it is that clinic you went to is a concussion clinic. And lots of the people who are having those scans tend to be sports people. So they're checking that their eyes about to help because they have to track a cricket ball coming towards them or something. So
sports people and children falling out of trees.
Yes, exactly.
Really, kind of sounds like me.
Who's hitting their head and doing things they shouldn't. So obviously it makes sense that they need to be tracking things. But yeah, it is kind of fascinating that actually how your eyes move, how quickly they respond to like external stimuli can be indicators of other things as well. And you have your sort of optical tests now. And last time I got my eyes tested, there was a sort of add-on for more general eye health, which never used to be a thing. So you can get your normal like eye tested, which is the standard, like, do you need glasses? And then you could pay, I think, 20 extra pounds or something. And they did a sort of more holistic measure of eye health.
I have that. I have to have that because we have glaucoma on both sides of my family, and I don't know, there's something else as well. So I had to have that as standard.
Yeah, so I think that's the same thing. They're using some of these measures to like for like potential like broader measures of health that can be seen through your eye, rather than just we're testing your eyes if you need glasses or not. So I think we'll sort of start to see these technologies come through our optical kind of annual exams and things like that. But yeah, really, really fascinating stuff.
Maybe Neko Health, as part of their preventative health, maybe they'll offer like some kind of eye scanning service where
it's strange, isn't it?
Where they I don't know, look at something in your eyes to tell you something about your health.
It's funny though, isn't it? Because you start, the second you think of like eye scans, especially going into someone like Neko Health, which is a very sort of futuristic vibe, you immediately think someone's going to steal your identity and like use it for sort of getting into your phone, home, automobile, whatever that might be. So yeah,
and it's funny because you don't think that when you go to the opticians.
No, exactly. You don't think they're stealing.
It goes to show the importance of trust and how trust is built over time.
Yeah, and also opticians usually feel quite dated, so you don't think they're using anything. You're not walking into this like beautiful like green like lights room. It's usually just.
Although does that make them inherently more hackable?
Yeah, exactly. Yeah, it's more dangerous, not less. Yeah, very cool.
All right. Well, I guess we should probably talk about some news.
I'm having fun, Jess. No.
I'm having fun too. Well, first news story is, and we're not going to label this one, but Perplexity Health has been launched. So it is the fourth major AI platform to launch a dedicated health product in less than 3 months. Fourth, no, that must be fifth, because OpenAI, Microsoft, Amazon, in fact, it's more than that now, because Google have done it too, and obviously so have Anthropic. So yeah, God, everyone's at it. I think that's the point. Like, there's actually no like massive differentiators seemingly at the moment between any of them, and yeah, it doesn't seem to be massive differentiation in terms of how they say, how they're keeping your data private and all that sort of thing. So I don't think we should dwell on it too much. There's not really that much more to talk about than we've already talked about, but it is worth an honourable mention just because it's another one. It's another one, and I think, as we said, the race will be won through the organisations with the greatest distribution. I think are going to roll it out the furthest and the widest. And
actually, it leads into our next story of the day, which is obviously about Microsoft, which I know you'll get to in a minute. But Microsoft, for many companies, won the race for sort of Slack versus Teams because they just rolled it out to everyone for free of charge when the world went remote, and now everyone's stuck with it for want of a better term.
I have a visceral reaction to Teams. Truly.
So do I. I feel bad sometimes that I just it is visceral. I'm like, oh
yeah.
I'm like, it didn't deserve this, but then it should do better.
Yeah, it should. I think, back to the distribution thing as well. Like, from an NHS perspective, every NHS organisation is operating on Microsoft, and so we talked about this before. It's really easy for them to roll out new products, and so again, it maybe from a UK health perspective, if we look at that sort of like system level, maybe Microsoft might be the front runner versus Google or Anthropic or one of the others. And you might see that, for example, I know that lots of startups use Google products versus lots of public sector organizations are using Microsoft products. There's different winners in different categories, but I'm still interested to see who wins the consumer race.
Definitely.
And what I guess we'll follow week by week. We'll see who's next to roll out their AI play, health AI play.
It's interesting as well, isn't it? Because, like you say, if you think of organizations, NHS versus consumer, you've got Microsoft versus Google. But then if you think of people's personal devices, phones and things like that, the divide tends to be Google versus Apple. So you tend to always have these like two players against each other. So how are people going to engage with these like health agents? if they're using their phone, then they're probably going to be either Apple or Google winning that race, unless you can find ways of obviously embedding it in and bringing it in. So yeah, it depends of the access point as well.
Yeah, I think we also talked about that AI, Apple. I don't know if they'd rolled it out or they had started rolling out and then they kind of pulled back on it. But I wonder if now they are kind of left with no choice but to bring out a product. And maybe what they were doing was just tightening up and they weren't happy with it. And you know that I don't think they need to kind of rush to get it out, but I feel like it's kind of a non-negotiable now at this stage, and it's just going to be an expectation. So I think it'll be, to me, it seems less of a question of if rather than when.
Agreed.
So yeah, maybe that's the one that will be in next week's Pigeon. But watch this space, I guess. As you rightly say, though, next story is about how hospitals are using co-pilots, and incidentally, Microsoft's Dragon Copilot, very much on the focus on that admin burden that we talk about a lot, that is not anything new for anyone in the healthcare domain, and really looking at how, by addressing that admin burden, they can free up staff, particularly clinical staff, to be able to focus on, placing the hand on the patient and spending time with them and providing that direct patient care. But yeah, Belle, you've read this one. What's the TLDR?
Yeah, I mean, it's a nice story, isn't it? So Manchester University NHS Foundation Trust has announced that they're rolling out Microsoft's Dragon Copilot across the foundation, as Jeff rightly said, in order to sort of reduce clinical admin and free up staff to do more of kind of great clinical work. And it's being used elsewhere as well. They mentioned in the piece, Guy's and St Thomas's, Imperial College Hospital are already using Copilot with great success amongst their clinical and non-clinical teams. What I found interesting here, so there's a few ways as to how it works. So the Dragon Copilot is essentially an ambient technology which will sit in the background and sort of listen to the conversations that clinicians are having with patients. So it sits in the background without someone having to actively take notes, to turn something on, turn something off. And then it, off the back of that, drafts essential documents, creates letters, all that require clinical sign-off. So they're not sort of being done and pinged out to patients without that clinical oversight first, which I do think is really important. We've talked before as to, if something goes wrong, where does the blame lie? And I do think you need to have a very kind of clear ownership of someone saying, like, look, this can help, but someone has to approve it, review it, check that they're happy, they're accurate, it's accurate, and sign off on it as well. So that's kind of what it's supporting with. But what's really nice here is sort of the scale of adoption that they're talking about. So the Foundation Trust has already got like 1,500 licenses, and they're planning on adding 6,500 more every year. So really ramping up the scale of this quite quickly. And what I thought was most interesting is, in addition to sort of the clear-cut use case that they've already said, they are building what they call an agent factory. So it's a dedicated centre at Manchester University Foundation Trust for teams to design and deploy custom AI tools that will automate routine operational tasks across hospital services and departments. So I just think this is really cool, because what they're basically saying is, instead of just rolling out a feature that they think people will want and will be useful, they are allowing the teams within the hospital itself to design what they need. So do they need to free up time from filling in forms, or is it something else where they're kind of finding that a bit of AI assistant would really unlock something? We talk a lot, and lots of the conversations I had yesterday at Rewired are about this, but we talk a lot about how some of the best healthcare tools are designed with clinicians at the earliest stages, so that they can say, look, this is what we need, and this is what our current workflow is, so that you don't have to adopt this thing which might not work with the way that your hospital uses tools and technologies, and can be seamless. And I think this is the same thing. If you get that clinical, firstly, buy-in from the very beginning, because they're invested in using it, and then also get that insight very early on as to what the best use cases are, we will hopefully over the coming months and years see some really great news from both Manchester and I'm sure other NHS trusts across the country of really interesting AI tools being designed in hospitals using these co-pilot and AI technologies. So yeah, that's the piece that really stuck out to me.
I think for me, there's two things it raises, and I think I completely agree with you, and I love the fact that there's almost this marketplace of agents that clinicians and teams can go into and explore and I don't want to say develop, that probably is an overclaim, but adapt to suit their specific use case. And I think that even if it's a lower level, I think that co-design piece is so important for getting that adoption and actually getting clinicians to use it. And I think that also comes from having a sense of ownership, and they feel like they've built it to suit their own personal needs, and I think that will make such a difference to the stuff actually being used, because we talk so much about products and solutions that have been built, but actually they're not going to make a difference until they get into the hands of clinicians. And so actually being able to bring them on that journey, such a valuable step. And so I think that's one thing that they've got really right there. And I'm interested to see, I would love to kind of see some behavioral analysis in kind of 6 to 12 months time to understand the impact that's had, if it has had an impact. I'm hypothesizing that it will, but to understand, and also I guess not just in terms of adoption and rollout, but also trust and sentiment towards it. I guess the other side of this as well is, and I think we've talked about this probably at length on numerous episodes of the podcast, which is it feels kind of like an unfair monopoly, though, where, as we've just talked about, Microsoft have this massive distribution opportunity across the NHS. And so where you have other companies who exist to exclusively build, a certain type of agent or a certain type of AI solution, or even just any kind of solution. But we're seeing it right now with ambient voice scribes, ambient voice technology. It is just a function now of Microsoft, and they can just click one button and roll that out. And then what does that then mean for innovation in the industry and for those companies? Is there a market for them? And appreciating that they can be more agile and they can bring and develop and optimize that technology much quicker. They don't have that critical mass that a Microsoft or another an EPR perhaps does. And I wonder if, I think that there's clearly I think market competition is really really healthy thing, and we should not lose that. But I wonder if there's also something wider at play, which is maybe some sort of mindset shift where, rather than building standalone products, we shift a mindset where we're using technology to build features rather than with the intention that the key customer is the NHS or a healthcare organization. Actually, it's to get acquired as quickly as possible, and actually you get that technology to the best place that you possibly can, because you have that agility, and you have that inherent innovation that the much bigger big tech companies don't have, to then basically get acquired and that feature become part of the product suite that they have. I can't make my mind up whether that would be a good thing for innovation or not, but I do think that it requires a shift in thinking about the commercial model, and also how you build products and solutions right from the very beginning. I think because often, as I say, you see companies where they've built an ambient voice scribe, for example, or ambient voice technology, clinical scribe. Oh God, I can't get my words out today. Sorry, I'm so tired. Sleep training is going really well. Parents who know. So my ability to string a sentence together is somewhat limited today. But anyway, we look at companies like Heidi who are dominating in Australia, and they've come over to the UK and doing super well, and getting adopted. But and then maybe that, looking to US and other markets. And I think does that play works for now for some companies, but I just wonder whether there's a future in that approach, and maybe we need to be. I just think maybe it brings rise to new commercial models, which will increasingly see, and maybe companies getting adopted much earlier, being acquired much earlier. So, they focus on the build rather than the scale.
Actually, it's a slightly different thing. But some of the companies I was talking to yesterday, they were saying that, one in particular, I forget the name right now, but they have a new product that is web-based. So it's a product for analyzing medical imagery. It allows you to sort of look at cross-sections of kind of different medical images, and you can view them with and without AI sort of side by side in order to sort of analyze what the images show and sort of help clinicians make decisions. But they were saying that one of the interesting features, if we can call it that, of their product is that it's web-based, which means someone doesn't buy one version of the software. They log into the latest version, and thus every time they add on new features, everyone gets it at once. Not just some customers that are paying for more, like the whole product will be upgraded as time goes on, and those features, the newest and best-in-class features, will always be available to those people that have the product, which is a sort of different version of what you're saying. You're kind of saying like a big Microsoft can add in another product or feature. There's a smaller use case of that product.
That reduces the friction then, doesn't it? Yeah.
But you're not having to sell in a new thing each time and say, look, we've got this new feature. Do you want us to add it in? Do you want us to come in and install it, educate your team on it? It just happens. It gets upgraded, and people adopt it as they go, which I think is really interesting.
Personally, I would love it if that just happened to my computer and all the updates that need to be done, but I think I can select for automatic updates. It's just that I don't close anything often enough for them to happen.
My computer forces the point sometimes by kicking me off everything and slowing it down. So I'm forced to restart, and then it'll be like, oh, you're due an update.
Go for a walk. You go and do a system update outside by getting some vitamin D, and I'll do a system update here. And by the time you get back, we're both going to be doing much better.
Yeah, press ignore, and then the computer's like, stop ignoring me.
Well, on that note, let's dive into our final story of the day. This story is a Health Foundation survey, and it's exploring use of EPRs. Now, everyone knows EPRs, electronic patient records, and it's looking at how they're being used by the NHS, how they're being received by staff perspectives, whether or not it's making a difference, how it's making a difference. And I think it's fair to say for many people working in the NHS, aside from Microsoft, as we've talked about, and emails and all that kind of thing, the EPR is almost like kind of it's sort of the front door to digital health and health tech, in the sense that it's the first interaction most people will have with some kind of specialized digital health platform. And I remember a report back from, I think, like autumn last year, which was looking at a sort of adoption of technology, and it sort of echoed some of these findings, which basically said that clinicians' experiences of using EPRs actually influence their perspectives and their trust in other health technologies, and therefore the adoption and scale of those health technologies. And where they have a bad experience with an EPR, it really erodes that trust and their motivation to want to utilize and take on new platforms and new solutions, because they are mistrustful of it, don't believe it's necessarily going to make a difference. And some of these findings are like really starkly similar, in the sense that 64% of people who were interviewed who responded to the survey said that it actually added new tasks to their workload. And we know that that's a classic like red flag for clinicians anyway, but for adoption of anything. 62% are saying that tasks take longer, and 53% are saying it's made their work harder. And I think at a time where we have this narrative of productivity and how technology is being measured on its ability to make delivery of care more efficient and more productive, and clinicians more efficient and productive, and create more time in the day and reduce the admin burden. And I think it's quite disappointing. And I think part of this goes to show that one of the big reasons for it is because only 46% receive basic training on the system.
Right.
And people are busy, and so finding that time can be really hard. And so also maybe it's looking for a different approach to how you train people, so that it is easier, it's quicker, it's seamless. And coming back to what you were saying about the Microsoft story, co-creating it with clinicians to make sure that it is going to make their life easier. And I think the flip side of it is that even despite this, even despite the friction, the findings do show, though, that 75% of staff think that it's improving patient care. And I think that's really testament to, we know how brilliant people who work in the NHS are. We clapped them to celebrate their efforts in the pandemic, and Lord knows they deserve so much more. But despite the fact that it's added new tasks to their workload, it's making things take longer, and it's making their work harder, in all instances, more than 50% of people said that. 75% still think that they're improving patient care. And I think that takes some commitment when things are being made harder, that ultimately you're keeping your eye on, you're keeping focused on the fact that it is making a difference for patients. So I do just think it goes to show that, and not just that, also I think we talked about, rollout and dissemination of digital health solutions, and EPRs are such a phenomenal opportunity for other solutions to be able to integrate with, to get directly into the hands of clinicians. And I think lots more companies and innovators are locking onto that, and we're seeing loads of EPR partnerships coming up, and EPR integration being really shouted about as a real benefit and feature of the solution that they've created. But we could just be making life so much easier if we do that co-creation piece, and actually we look at how it is creating this friction and making life difficult, particularly at a time where there's rumors of this, I think it's a $4 billion government fund for using AI to increase and improve productivity within the NHS, when we're not getting the basics right to improve the productivity into the NHS. And so I guess great that that's potentially on the horizon, and I think that will make such a difference to so many of these companies who have the opportunity to do really amazing things, particularly where they're integrating into EPRs. But actually, it's almost like, let's get the foundation right. And the EPRs is that foundation. So, yeah, I'm literally echoing what we're saying in Pigeon here. I've just got on my soapbox, but yeah, we've got to get the basics right. We've got to get the foundation really solid to build on top of, because otherwise it all just becomes very shaky.
Yeah. I think what's interesting to me is that, like you say, 62% of people say things take longer. Only 46% of people have basic training, yet more people than that say it, they're seeing the positive benefits of that. We know that if you want any sort of digital transformation, onboarding needs to be a really critical part of that, whether it is by co-design or whether it's by something else. But overstretched people don't have an hour, 2 hours to learn a new technology, to work out how it works, to find out its quirks and things like that. So that's something which is critical to get right. I also think, and I think companies are very aware of this, having a vocal advocates for EPRs, for your technology within the clinic, the hospital, is so important. Because if you, as an overburdened clinical member of staff, have someone else in your team that have spent that hour learning the things and can say, look, I know it's an hour. I promise you it's worth it. I've already saved more time this week than I've invested. My notes are better. They're sharper. I'm feeling less stressed. And I can cover my workload, and I'm freeing up time for clinical capacity, whatever that might look like. But having those advocates or people that have been like, look, I've done it. It's worth it. You should do it too. That's where we can really start to see the benefits. And so it's finding those advocates really early on, and whether that's through the sales process or whether it's even earlier than that, and it's through the original, surveys that kind of design, like end up with the design of how the product looks, how it works, how it integrates with certain workflows. But I think that's really critical. And having advocates not just at the surgery level, but having them at a broader level as well, so they can sort of really, it should be a nice, when you get an exciting technology, people should be excited about it. They should want to use it, but like, oh my God, can't wait to get my hands dirty and get my hands on this. And
but that's exactly the point. When they've had bad experiences with technology previously, they're just not going to think that. And I think
exactly.
I like what you're saying there about that advocate, and shout out to James, because he's mine. I let him do the exploration on the tech, and then he's my personal tech support. So I definitely always go to him, and everyone needs someone like that. I think
it's valuable.
But I think, rather than that person being someone necessarily who's in the company that's created the solution, I actually think that those need to be people who are part of the teams.
I agree.
Because
absolutely.
Because there's that trust, and going to someone who knows and understands your job and what you're doing, and I think, and that they understand your context, I think makes such a difference, rather than someone, and it's absolutely no shade to companies who, by the way, I'm sure put on a phenomenal, customer support and training and all of that sort of thing. It's just not the same as being able to turn to one of your colleagues who just gets this stuff and be like,
exactly,
hey, how do I do this? Or like, I'm trying to do this thing and I can't figure it out. What do you do? Or whatever. And I guess that like enthusiasm maybe is a stretch, but like their enthusiasm for a technology or the solution, I think feels them more genuine coming from them, rather than from someone from the company who really wants you to use it.
I couldn't agree more. It needs to be someone that understands the local factors. It understands because every clinic runs on slightly different workflow, software, timeframes, numbers of staff, peak hours, whatever that might look like. So it's understanding that and saying, look, even with that, I've tried it. I've spent the time learning it. I promise you, it's worth it. It's gonna make your life easier. And then it's in chemistry, they call it, the activation energy. Like, how much energy do you need to input to overcome that hump and make the reaction happen? And it's that, like, is it worth you putting that initial effort to then, get to the end goal?
I think it's also fair to say, though, that some of those people do already exist. There'll be some organizations who do have those people and those roles, and I think, but also a lot of it comes down to like people's personal passions. There are some people who just have more affinity for technology and enjoy it and become, the de facto tech support, like in my house. but I think that it's inconsistent across healthcare organizations in different parts of, it's certainly the NHS here. And, regardless of what country or organization you're in, it is just so varied. Well, I actually didn't think we were going to have that much to talk about. And
we've put the world to rights.
We have put the world to rights. We've not necessarily invented anything new, but we've anecdotally validated some cool products.
Yeah, everyone's doing great.
Yeah, everyone's doing great. If we could just get some like nice wearable jewelry, though, that would be ideal. Just putting that out
anyone
into
wants
the
to
world.
hook us up with some nice wearables. Also, I mean, I'll try out some smart tampons. Like, hit me up.
You spent too long walking around a conference looking for freebies.
Yeah, right. I'm like,
why aren't they giving out smart tampons for free?
Yeah, right. Where's my Harpic collab when I need it?
Yeah, right. Toilet duck. All right, on that note, before this descends any further, thanks for breaking down the Healthtech news with me, Belle. And I
Thanks
think
for having me.
We'll be back next week, hopefully having slept a bit more, a little bit more coherent, and with some more weird and wacky ideas for what we should and should not be doing in Healthtech. See you later. Bye.
Nice. Bye-bye.